92.7 WOBM. A good morning to you. It's the Ocean County Breakfast Show. Missing Sean today, of course. Just Sumo by your side. And Meridian Health is in with us. Dr. Kwon, good morning.
Good morning.
How are you today?
Good.
So we're going to talk a little bit about peripheral heart artery disease known as PAD. Can you explain that a little bit?
PAD, otherwise known as a peripheral arterial disease, is basically a blockage, a narrowing of the blood vessel that's leading to your extremities, arms and the legs, and viscera, and to the head. It most commonly occurs in the leg, and the blockage is usually caused by a plaque, which is basically a fatty material that deposits along the blood vessel wall.
So could this lead to something pretty serious, like a heart attack, or would this be more of a blood clot?
PAD, if it occurs, or the blood vessel blockage, actually, if it occurs in your heart, it's called a coronary artery disease, and it could cause, obviously, a heart attack. If it happens in your neck, carotid artery disease causes stroke. If it happens in somewhere else, like a leg or arms or the viscera, it could cause a gangrene and the loss of limbs.
What are some common symptoms of PAD?
PAD in general, in the early stage of the disease, there are no symptoms. For vast majority, initially, no symptoms. As disease progresses, about a quarter will develop symptoms, and it could range anything from aches or tired legs, especially when you exert yourself, like walking or climbing up the stairs. And the symptom will come on regularly on a certain distance, and the patient will notice the regularity of the symptoms.
But it seems like, this is what scares me, doctor, a little bit. It seems like something that could just happen like every day. Oh my gosh, how do we not panic about this? I get a couple leg cramps like the Charlie horses at night. I mean, what do we do to know that it's nothing real serious?
The lower extremity pain is relatively common. It could, there are a lot of other conditions that could cause leg symptoms.
Okay.
Like arthritis, nerve conditions, muscle aches, and fatigue, and so forth. If you have a risk factors for PAD, such as high blood pressure, diabetes, high cholesterol, overweight, if you smoke, and if you actually have a family history of PAD, then you should definitely consult your physicians.
Something I never really heard of. I mean, is this common?
It is really common, actually, believe it or not. Because of PAD, it affects about 8 to 10 million Americans. And because the PAD does not cause much symptoms initially, it is, patients usually not aware and doesn't know, but towards the end of the stage and late in the disease, the symptoms could be quite severe. And that's when it gets unmasked. And
Dr. Kwon, what should we do if we think something is just a little off? Head to the hospital, I guess. Is that the best way?
Well, no. Usually, if you think you're suspecting some of the symptoms of PAD that I mentioned, you should definitely consult your physicians. The diagnosis can be relatively straightforward. It could be done with a physical exam and small non-invasive exam, basically measuring the blood pressure in your leg comparing to the arms, and that can be easily done.
All right. Well, Dr. Kwon, it was so nice talking to you, vascular surgeon and with Meridian Cardiovascular Network. Thank you so much. And Jersey Coast Vascular Institute. So let's all be sort of on the lookout for PAD, but just make sure that you get checked and make sure if there's anything irregular out of sorts.
Yes.
Right, Dr. Kwon?
Yeah, absolutely.
Thank you, with Meridian Health joining me today on 92.7 WOBM.
Thank you.